Hi, we're at the Community Diagnostics Centre here today at the old Sainsbury's supermarket site just outside of Hanley, where the breast screening unit is situated. And we're here to meet Gina.
Hi, Nick.
Hi, Gina.
Nice
You
to
okay?
see you. Yes, I'm very well, thank
Good.
you.
Can you tell me what they expect when they arrive for their appointment, please?
Of course. So when the ladies come onto the mobile unit for their breast screening appointment, they will always be greeted by a female member of staff. The female member of staff will ask for their name,
Yeah.
the date of birth, and their address. Once they've done those checks, they will then invite the lady through into the changing room, and we'll bring the lady through into the changing room here.
Yeah.
And then we'll close the door behind us, and what we will ask is some more personal questions about has she had a mammogram previously, has she had any previous breast complaints, any previous breast surgeries, family histories, and does she have any concerns today. We'll also ask if she has breast implants, and we'll check all of those checks, and we'll also ask if she takes HRT. Once we've completed all of our checks, what we'll say to the lady is if you wouldn't mind removing your top garment, so your top and your bra, but you can put your cardigan around yourself just to keep yourself warm and to sort of protect your dignity. So all our checks are now being performed. So I'm going to close this door, and what I would like the lady to do is lock the door behind me because all of her belongings will stay in the room. Yeah. And what will happen is our female member of staff will come through the other side, and she'll knock on through for the lady to come on through.
Thank you.
The what we classify as the mammo room. So it is a controlled area, and we do have x-rays, so it's only staff that are allowed in there, and also the lady that's having the mammogram done.
Okay.
So come on through. So this is our mammography machine. Okay, so what we will do, well, what the female operator will do, is she'll go on here and she'll check all the details, match up with the paperwork, and once we are ready, we'll knock on the door and we'll invite the lady through to come on through. What we're going to do is 4 pictures, 2 on each side. We will compress tightly just for a few seconds. Most ladies like an experience a little bit like having the blood pressure taken, and that tightness is really, really important because it helps us see clearly within your breast. So one of the first images that we do is what we call the CC view, and this is we place the breast here on the machine. So the lady is standing forward, lift the breast up onto the machine, and what we do is we compress tightly for just a few seconds. And then what we'll say is please stop breathing, and the operator will go round behind the control panel, press the buttons, the machine will make a beep, and the machine automatically releases. The operator will check the image, make sure it's clear, we've got all of the detail on that we need. And once the operator is happy, she'll then say to the lady, we will do the same on the opposite side of the opposite breast. Again, square on, bringing the breast onto the plate, compressing just again for a few moments, nice and tight. Again, ask the lady to just stop breathing just for a few seconds, go around and press the button, and the procedure repeats. Once we're happy with those images, what we'll then say to the lady is we're going to do 2 slightly different pictures, and what we will do is we will move the machine. So on this mammogram, we will get the lady to bring her hand behind her head, and getting the lady to stand close to the machine, we will get her to tip sideways. And what happens here is this corner of the machine just sits nice and tightly up within the armpit area. And then we'll get the lady just to relax, and it's really, really important that you relax. And then what the operator will do, she will smooth out the breast tissue, and again, she will compress closely and tightly just for a few seconds. Again, get the lady to hold her breath for a few seconds, press the button, and the operator will check those images. Again, if she's happy with those images, she will then repeat the procedure. We'll move the machine automatically moves round, and we'll repeat the process. Once those images have been checked, we will then check all 4 images to make sure we've got exactly what we have and exactly what we need, and if that's if we are more than happy with that, then the lady is free to go home. We take to the lady, you have your results within 2 weeks, and that is the normal process.
Why is it important to attend for screening, please?
Unfortunately, breast cancer is the #1 cancer to affect biological women. So 1 in 7 biological women, unfortunately, will be diagnosed with breast cancer at some point in their lifetime. What we do know is that screening saves lives. And if your breast cancer is diagnosed with a breast screening program, 9 out of 10 ladies will go on to make a full recovery.
Right.
What I will say to ladies is we can never ever stop you from getting it. We just need to find it first, because that's what makes a difference.
Gina, what about patients that need reasonable adjustments?
Yeah. So as a service, we offer a range of reasonable adjustments. So for example, if a patient has a learning disability, what we'll say is, please let us know beforehand, or for your carer to notify us. And what we will do is we will offer a longer timed appointment.
Right.
We send out a PHE pictorial invitation letter.
Yeah.
Also receive a pre-screening phone call from myself. Just have those conversations before the appointment takes place as what those reasonable adjustments are.
Yeah.
And what we say is, for ladies with a learning disability, please bring your hospital passport with you.
Right.
That's really important, especially if a lady is non-verbal, because it gives us that background information as to what those needs are for that patient.
Excellent.
But yeah, they will still have exactly the same procedures, just that we offer longer timed appointments.
Great, thank you. So tell me, if a lady's got a breast implant, can she still have a mammogram?
Yes, she can, and she can still come onto the mobile screening unit. It's just that we need to know beforehand. So when we do invite ladies, it does say on their letter, if you have breast implants, you need to phone us beforehand and let us know.
Okay.
So ladies would still have the same procedure as what a lady would have if she didn't have breast implants, but we just need to tailor it slightly. So it's really important we know about that beforehand. But yes, they can come on to...
So the more information, the better.
Yeah. It's also really important for ladies to tell us if they have a pacemaker before attending for their appointment.
Yeah.
So they can still come along and have the same mammogram procedure. It's just that we need to know beforehand, so they need to let us know.
Lovely, thank you.
Okay.
Thank you very much for today.
You're welcome.
For me, for my personal journey, it was a positive experience. It
Good.
was 9.5 years ago, and I feel absolutely normal. Mine was caught super early.
Good.
So for anybody out there, please get yourself checked.